There are new efforts underway in St. Paul Public Schools to help high school students improve their mental health and prevent suicide.
Brandy Powell's in the newsroom now with how a new federal grant to Minnesota Community Care is helping give more direct care to students, Brandy.
Matt and Leah, the National Alliance on Mental Illness says the average age for early signs of mental illness is 14 years old, but most people don't seek help until adulthood. What's more, the Centers for Disease Control and Prevention says suicide is the second leading cause of death for people ages 15 to 24 in the U.S. The hope is new money to start new programs will change that. New this year, Minnesota Community Care received a $150,000 a year grant it'll use at 10 St. Paul public high schools. In part, students will have access to teletherapy with a licensed pediatric psychiatrist when an office visit isn't possible. This way, more in-depth diagnostic assessments can be done and medication can be prescribed if needed. So it's a private way to meet a growing need.
True. And it also is connecting families that might not otherwise be able to connect with those services.
The money will also be used for health educators designed to reach students before more intensive clinical care is needed, and also outreach workers hired to talk with families at home and students in the classroom about how to access the new care that's available. Randy Snyder, a social worker at Washington Technology Magnet School, says this new effort is a way to get parents and teachers to better understand students' mental health needs.
So I think the district's push to try to help all of our staff understand the life experiences, the sometimes reactivity and trauma experiences that a lot of the kids have it's really important that we have our heads around that.
Last year, there were no licensed trauma-focused cognitive behavioral therapists in St. Paul public high schools, but to meet a growing demand this year, Minnesota Community Care says there are 9. And that new federal grant to Minnesota Community Care HealthStart program that's being used at St. Paul Public Schools goes from this school year until 2023. It'll help students as young as 14 years old. Leah and Matt.
Yeah, Brandy, thank you. An important issue to really pay attention to. Thanks.